is Kayleen. I'm going to be one of the nurses here today. And I'm Tori. So can you tell me exactly what's going on with you?
I had some burning and
Okay. So I'm going to ask you a couple questions. They're going to be a little personal. Your answers are going to stay between us, but to get an accurate diagnosis, I do need honest answers from you. How many sexual partners have you had since your last checkup?
That is true.
It is. But it is an important question.
Well, it's not something I usually like to discuss.
I understand. But I do need an answer just so I can get an accurate diagnosis on exactly what's going on so we know what to test you for.
Okay. Well, I just have my boyfriend here.
Okay.
Okay, so what Kayleen did there was testing, and what testing does is better help you understand and know where the patient's coming from to better help the patient.
Okay.
Does that mean you had unprotected sex with your boyfriend?
With Peter, yes. We were in a committed relationship.
Okay, so what Tori did there is she was probing. It's something that you need to avoid to do because probing doesn't better help the client and their needs, and it's considered to be prying and violating their privacy.
So since you're unmarried and you have a boyfriend and you had unprotected sex, does that mean you have a kid?
Actually, I do. I'm sorry.
Right there, what Tori did was passing judgment. It's giving opinions and disapproving responses as well as moralizing and implying one's values. It's not something you ever want to do to a patient and you want to avoid at all costs.
Well, you check the restraints every hour. You take them off every 2 hours.
It's okay.
I don't know this.
You don't need to be upset.
She's sitting here giving me a hard time about having a child. She doesn't know me.
Exactly, and we don't know you.
I don't know if my boyfriend gave me something.
I can understand you're very scared, and I think anyone in your situation would be. But you need to say that you had sexual activity with multiple partners, and this means that the pain and discomfort you're feeling could possibly be an STI. And we just want to find out answers. It happens to a bunch of people, but we just need to figure out exactly what it is so we can get you on the right kind of medication.
Okay, so what Kayleen did there was provide touch, which allows to reinforce caring feelings to the patient. She also reinstated and paraphrased, which implies the nurse has listened to the patient and has understood the client's basic, or to understand the client's basic message and to offer the client a clear idea of what they just said.
Now, Julia, I can't tell you exactly that answer right now, but what I'm going to do is we're going to get some of your blood, and I'm going to send that off to the lab, and as soon as I get the results, the first thing I'm going to do is I'm going to come back here and tell you exactly what's going on.
So what Kayleen did there was provide, or giving info. So it provides in a simple and factual manner into the client, or to the client, which the client may have or may not have requested that information.
So like I said, as soon as we know, we'll be right back to give it the answers, and someone should be here shortly to take your blood for you.
Okay, thank you.
All right? Thank you. Peace. I'm Tori. What's up?
In my vagina?
Oh, wow.
Shouldn't normally be there.
Like what?
It was red and
Like STDs?
I have herpes.
Yes. I'm sorry, I can't discuss that with you.
She has the herpes.
To relieve you of some comfort.
Can you tell me why I have herpes, Peter? Peter, get your ass in